Hello.
Hi, John.
Hi, this is Kate Shamas from Meditech.
Hi, Kate. Nick's on.
Hi, guys.
Hey, Nick. Hey, Jennifer.
Hey, everyone.
Hey, Jennifer.
Hi.
Matt.
So just as we're getting spooled up here, I've made Matt, both Matts, and Julia and John co-hosts. Is there anybody else who needs to be a co-host?
No, I think you're good.
Okay, I'm just going to just mute us here until we're ready to go.
So that means you don't have to change the tense of the verb. Right. I knew you would say.
Hi, I'm Carly from Meditech.
We'll catch up on Monday. We'll have a team meeting on Monday.
Hi, everyone. We'll just give one more minute and then I'll pass it over to Karen to introduce our session and then we'll get rolling.
What do you think, Jennifer?
Yeah, I was just going to pass it over to you, Karen. I think that we should get rolling because we've got a lot to jam pack into the next hour. And so the Zoom call is open. So if people join and join a little bit late, that's okay.
Perfect. Thanks a lot, Jennifer. And looks like we have a great turnout today. So thanks, everybody. Friday at noontime. Absolutely amazing turnout. And and there's more coming in. It's very exciting. This is, I think we've had 4 sessions, 2 on really how, on how do we integrate and collaborate. How does Meditech help us to integrate and collaborate together to help and support individuals receiving health and social services, whether it's a patient or a client. So it's all really very, very, very exciting. And we have changed this session around from the one that we did earlier, and based on some of the feedback that we received the other night. So we're going to actually this time start with a little bit around where we're at and what we're doing, and John Hord's going to do that from Health and Social Services, and then our friends from Meditech are going to talk to us a little bit about working on designing the processes required for physician building. So we'll see that sort of next, and a little bit about patient and chart documentation from the front office. So this is a bit of a the session is a little bit more in depth, recognizing that we're still in the development stages. So it's taking the Meditech platform, we'll say, and then we're adjusting it to Yukon standards and getting our material in so that we can launch forward. Also recognize we're going to be moving forward in phases. This isn't going to be the Big Bang Theory where we actually implement everything at once. It will be over a period of time when we bring people in, starting with the hospitals and the health centers, and then moving on from there. It's exciting. I think those of you who've heard me say this, we're one of the few jurisdictions that is really, really working on a One Health model. We have that opportunity. It was served up to us when the hospital need to update Meditech, and we've seized it and are moving forward. And it's very consistent with putting people first, which was the health review, Health and Social Services review that was completed with recommendations coming forward. And certainly the team of experts that looked at it, looked at our health and social services system, saw One Health as foundational. And it is foundational to actually integrating and coordinating services and supports for patients and clients across the Yukon. And it is a change for us all, but it is also, it's not just an IT system, it really is a backbone to making things work better for people in the Yukon. So with that, I'm going to turn it over to John. We'll have some time for some Q&A at the end of the session. Over to you now, John.
Great, thanks a lot, Karen. Hi everyone, my name is John Hort. I work with the One Health team on the specifically on the ambulatory build, so that's what we're showing off today. You might hear the word build used a fair bit if you engage with the project, and just to give you an idea of what that is, the build team, really that means we're working on the customization of the Meditech platform, specifically for the Yukon environment. So my initial sort of brief demonstration here is going to show you some of the work we've done to customize the system for our community health centers. But it's also going to be, give you an idea of how the customization works and would look in the physician practice sort of arena as well. So let me just share my screen here really quick. And just make sure can everyone see my screen there? I've got it looks like a scheduling grid.
Yeah,
got you, John.
Great. Okay, so just sort of a quick overview of the scheduling grid here. Any of these kind of systems are going to have a way to schedule appointments and so on and so forth. This one here you can see is our Whitehorse Health Center. If you need to look into schedules or do scheduling in multiple facilities, they would become available here. That's all handled through sort of access. And as you can see, we have all our health centers built in here as locations. Across the top really quickly is just the various resources and people that you would find in this health center on a given day. The Meditech demonstration later on for front office will show you it in a bit more detail. But I just wanted to quickly cover that, you can have a few different appointments quickly put together on here with a couple of visual indicators. This one here, for example, has a little red dot. This means this appointment was set for 11 o'clock. The current time is past that. The person hasn't shown up yet to check in. Whereas this one down here has a green dot, which means that this patient's actually shown up at the clinic and has checked in. And this will get reflected on the clinical side, so people can be notified from the front office that patients have arrived. Just really quickly too, while we're here, and just do a quick show that you can actually look at individuals' calendars. So you can take a weekly view. You can also quickly switch over to a monthly view. It gives you an idea of appointment loads for different days. So just so you can have a quick at a glance view of anyone, any scheduled person or resources sort of workload and appointment load. So now I'm just gonna quickly book an appointment for a patient. So this is where the master patient search. You can search, from basically any kind of information you usually can for these sort of things. So like last name test would bring you up quite a few people. Of course, you can narrow it down by adding more information. So I'm going to bring up a particular test patient here. To make an appointment, so for any locations, we build out appointment types that are relevant to your area. So for example, for the community health centers, this is the list of things they have. Adult health assessments, child health clinics, and so on. I'm going to pick a chronic disease assessment for this demonstration. At time of booking, you can also pick the provider that's going to be seeing a patient if you know who it is. And you can put in a visit reason. The visit reason is really useful for having documentation that will be available by default. And the Meditech demonstration will sort of demonstrate how that works a little better, as we haven't tied that together just yet. So we'll save that. And you'll see it just pops an appointment up on the screen. So pretty easy to just put an appointment in there. If we realize that, we wanted to move this one to either another provider on the schedule or at a different time, you can actually just drag and drop them to different times of the day. Warning in the past. This is at lunchtime. So the system will give you warnings for things that it thinks that you probably don't want to do, but it's a person-driven system, so you can always override it for various reasons. The system doesn't prescribe how you interact with it. So that's just a thing to keep in mind. It'll warn you, but it'll let you do what you need to do. So let's take this new patient. We'll check them in really quick. If there's nothing you need to really collect or do, you can just check them in right away. Otherwise, you can collect any forms or scan any documents that you might need for the patient at this time. We don't need any for this particular purposes, so I'll do a quick check-in. You can add a patient picture if that's something that you would use in your clinic or practice. And now that patient is checked in, as we can see by the green dot. So it's sort of a quick overview of how the front office operates with what we have set up. And you'll see a bit more detail on that with the Meditech demonstration later. For the time being, I'll switch over to the clinical side view. And once again, we're in the Whitehorse Health Center, and we can see all the appointments listed and the various statuses they're in. So we can see that new patient that I'd added there has now arrived. And it's as simple as clicking on that one to bring up that and jump into that patient's chart. Okay, so we haven't done much in the way of customization here yet. So I'm just going to touch on a few things really briefly and let the Meditech folks later on show you a bit more details here. But just quickly, this is the sort of summary page. This can be customized for your use in terms of what you want to see about your patient. Our default right now shows some lab results, previous visits, You get your allergies and problem lists down the side, medications. This side region, the reference region, is always here, regardless of which of these various tabs you're looking at. And then these tabs all have, you know, different views of the kind of information that you have shared across the system here. So the information here is generated, could be generated from the acute areas. It can be generated from other ambulatory clinics. This is basically like the shared EMR view with a customization to like how you want to see the information presented to you based on your you know, your specialty or how you interact with patients the most. Things such as the medical history, surgical history, social history, this is all here. And I just wanted to draw your attention here for a moment, because you'll see in documentation, if you fill in anything that's relevant to these various areas, it gets reflected here. But what's collected here also gets reflected in those documents, so that rather than repeatedly asking patients something that they've answered before, it's you can see what they've answered, and you know, it's more of a verification, which, you know, allows patients to really feel like they've sort of been heard in other areas of the health system. All right, so for this patient, I'm going to jump into documentation. We're going to bring in a COPD document. So I'm going to just sort of skip through to some of the things that we've actually done as a build here. So if I bring up this PDF form, so this is a form that we would see used in our health centers for a COPD flow sheet for collecting some data and doing comparisons against previously collected information. So we've built this in the Meditech style of documentation here, and you can see basically all the same answers will be here. You can answer questions. A lot of them are check boxes. You can add comments, things like functional status. We have, you know, some indicator text here to tell you like what the various numbers mean. You can just sort of basically go through, answer various questions, and so on. So, you know, there's some quick sort of checkbox style questions. There's text areas for answering text-based questions, numerical entry areas, you know, just the various kinds of data, discrete data and text data that you might need to enter. And then if you see, we come down to this tobacco region, and there's something already entered here. So this is what I was referring to with that sort of social history, where this person at some other point in their journey in our health system has answered the question that they are a smoker. And if we see this little green arrow, it says there's more information. And last time they spoke to someone about this, they said they were a smoker and they were contemplating quitting. So if you were to review this with them and things had changed and they are actively quitting, and you save that, this will be reflected back to that, you know, the central EMR and the social history. So this is part of the build work we're doing, is to make sure when we create these documents that they're tied together to those sort of common queries that, you know, allow this information to be reflected throughout the system. So that's a bit of sort of how the documentation looks, height, weight, you know, whenever these are entered. Again, these tie back to the patient. So when you see height and weight vital statistics in your reference region, the most recent entry for those things will come from the documentation that's done, regardless of what setting and what document specifically it came from. So once a document is done, you would just sign off on the document. At this point, you have the opportunity to send copies to another area, another provider. So, for example, if I knew there was another provider interested in this particular document, let's say Jill worked at the chronic conditions program, and I was going to probably be referring this patient over there, I can already add a copy to, and this will be sent over to Jill's workload there. You assign, you enter your PIN. PIN is required to do any document signing as well as order signing, so providers would have that. And then you're given a sort of a text view version of the data that was entered into the system. One next thing I'll do with this patient is that referral I was talking about. We'll do a referral order to the chronic conditions program. So it's as simple as doing a search for that. And we have some information to fill in here. Typically, when you refer to the chronic conditions program, you would fill in, you know, a form like this and send it along. It contains all the, you know, patient information, reason for the referrals, comments, you know, then some like specific programming you want to do. So the way we simplify that a lot through using these orders, because all of that patient information is already contained within the system. So you don't need to re-enter that. You just need to say, we want to refer to that condition support program. And then this is where we customize these sort of referrals. So these are the programs that were available on that system, and we built them into the referral itself. So basically, you just pick the ones that you want, attach the related problems. In this case, we'll say it's COPD, and then, you know, fill in any other additional comments to the provider. And instead of filling out that paper form and sending it over, sending with the patient, you just complete this, sign off on that order, and then that order is sent to the workload for that area, and they can then continue their workflow and work with the patient. Okay, one other thing I just wanted to show off is, again, it's very similar. It's another sort of document that we've built into the system. So for children, there's, if you're familiar with it, there's this Rourke baby record that's used for, you know, monitoring child progress through their early years. So we've taken this, the 2-year version. It has, you know, some text regions, again, some demographic information that you'd be able to get directly from the system, and a few other fields. And we've turned it into basically a document format for the Meditech system. So instead of those small text boxes, you have, you know, these areas where you can enter as much text as you feel would be appropriate. We have a height and weight data entry areas. So let's put some information in there. And we can do things like, you know, pre-calculate stuff like BMI so that you don't have to do that. It's, you know, the computer's already a calculator, so we'll use it for what it's good at. You can go through, answer, again, text-based. We have some sort of explanatory text that comes from the document itself. And then, you know, various other ways of entering information. So, you know, in the nutrition area, you go through and you want to review these things with the parents, and you want to be able to mark, you know, is there no concern? Is there a concern? If there is, you can enter some text. And so on and so forth. You go through the various areas. There's ways to answer questions. And at the end of it all, again, this stuff, once you've saved the document, anything that's sort of a central and common queries, such as you know, height and weight, those get saved right to the master patient record there, or the EMR, and then it would be reflected in things like the, you know, growth charts, which you can bring up. These are the WHO-based growth charts. Any measurements, whether they be from the Rourke or from any other, you know, visit with anywhere in the system, would show up on here. So you can pull up the information and do tracking sort of directly in here without having to pull out a chart and marking yourself. Let's see, I showed that. So we are still in the early stages, but this was just to give you a quick look at how we're translating the sort of forms and referral sort of information that we have for the areas into the Meditech system. And next, I think you'll be seeing from the Meditech crew that there's quite a bit more to the system in terms of like what's available in the EMR. And I'll turn it over to them to give you sort of a broader overview of the system, But hopefully this helped show you that, we are customizing it specifically to our environment up here.
That's great. Thanks, John.
You're welcome. Just unshare this.
So I think now we'll turn it over to Matt Chadwell. Matt's been working with some of our members of the One Health team to design the billing functionality within Meditech.
All right, thanks, Jennifer. Actually, turn on my camera here so Karen's not alone in the video world. I'm in my unfinished basement. I'm sorry about that. Anyway, again, my name is Matt Chadwell. I'm the Revenue Cycle Product Manager in the Strategy Division here at Meditech, and I've been tasked with the research efforts ongoing for physician billing in the Yukon Territory, and working closely with our development team to bring some tools that are specialized to the Yukon workflows for the physicians. And I have a short slide deck here I want to take you through. It's a high-level overview. I will stop periodically for questions, so ask anything you'd like, any curiosities. I'm here to help. And at the very end, I do give you my email address in case anyone wants to contact me. Feel free anytime to reach out to me. So let me share my screen here and get into present mode. All right, so random intro slide with somebody on a mountain. All right, so the overview of our physician billing efforts. So again, very high level here, but I did have some discussions with a few of the physicians up there. I don't know if they're here today, but I saw them on Wednesday, online here, of course, Dr. Bryant and Dr. Chow. And we went through the current workflow in their existing EHR software related to patient care, and then also some of the billing functionality. So based on that, and that drove a lot of our research efforts and will eventually be part of our design. Some of it is ongoing, but a lot of it is active development. So bear with me there that I do have a little bit to show you today, but there'll be further updates from me going forward. So when we were looking at the existing workflows, one of the first things we wanted to be able to do was automate the fee code capture, so that you're charging, and any of the medical coding that would all be generated based on the physician documentation. So point of care with the patient, as you're documenting, that informs the billing aspect of our software of what charges should be placed, so fee codes. And then it will also provide some of the medical coding based on that documentation. From there, we are providing, and this is still in active development, a new web charge entry. And this is going to allow for the adding, editing, and deleting of both fee codes and medical coding that was, again, provided through the physician documentation. So you'll be able to add additional fee codes if necessary, or edit them in any way. I will be showing you that web charge entry momentarily. This was an exact, or not exact, it was a tieback to the existing workflows of Dr. Bryant and Dr. Chow. When we were on that web meeting with them and they were taking us through their workflow, this web charge entry was a means to mirror what they're doing currently when they're adding additional fee codes and adding some of their coding aspect. Another important piece when we were looking at the existing workflow was not having to access a separate billing application. These physicians that are mainly, again, as you know, in the Yukon, are independent. If you're not backed by any type of billing staff or coding staff, there's a need to automate a lot of those billing functions so that the physician isn't taking time out of their day to then go into a separate application. So upon signing the documentation, we'll have the ability to post these charges and the coding, generate a bill, and then put out forms to be paid by. At claim generation is we're working right now with the Medigent spec. So that's the claim clearinghouse for insured health services. The format of that claim was an XML format. And XML it's similar to HTML. It's a web-based submission of data that's both machine readable, also human readable. It's organized in such a way that it's an electronic transfer. And when we were exploring current workflows in subsequent conversations with the Yukon, in particular the government folks, it was identified that there's staff that is converting the flat file currently out of the existing system and converting that to an XML and then putting it into Medigent. So here we're looking to get rid of some of that manual work for both efficiency and automation and have it be in XML format directly out of the Meditech system and moved into Medigent, where the assessors can review it and adjudicate that claim. We're also looking at, and this is where it actually, we're discussing with the implementation team on the hospital side as well, for the reciprocal claims, so out of territory claims. They're doing some work there to provide an automated claim for out of territory. And we're looking at aligning those efforts for both physician billing and the hospital side to have one claim form with some unique data elements and formatting as necessary to then automate those claim generation as well. The remittance aspect, that is still being reviewed. We need some further investigation. We had some recent calls and did receive a spec that the current EHR is using on the physician side, but we're still breaking that down, and there will need to be subsequent conversations on that to discuss the scope of work and what we can do to provide some remittance assistance. Lastly, and this is something that may have been more behind the scenes in the current system, we didn't really dig into it too far, but we're looking to provide a set of very streamlined, specific tools that can optimize the physician workflow and access to billing functionality in the event that you get a, for example, a yellow piece of paper for your remittance back from Yukon that you need to resubmit a claim, there's some edits necessary. We want to provide a streamlined set of billing tools that is very specific to physician workflow that would allow for this reclaim generation. So you'd be able to submit another claim. And if you need to add additional fee codes or update the coding on that patient, you'd be able to do that in a streamlined manner as well. So that would be kind of a secondary set of tools from the initial billing, which would be fully automated in what we're looking at today. I would like to stop there for just a moment in case there are any questions anyone want to ask on any of the content that is here and kind of the scope of work and scope of research that we've been doing. All right. Sounds like that all made sense then, which is good, I hope. So here's a look at our web charge entry screen. I have to make sure I had a couple of my notes just in case. So the first thing I want to mention to you is this is out of a US database. So I know the other night there was concerns that we weren't demoing in the Canadian release, and that was unfortunate due to the timing, since the Canadian release of our software and Expanse was going through an update and was still being validated, so we weren't able to demo live. This is similar to that, where the screen is provided out of a US release. I will tell you, however, that the workflow is identical to what you would see in both a US system and a Canadian system, in particular, in this case, the Yukon. The only, that's again, is a workflow consideration. The only difference is that you would see physically on the screen is the date format, of course, would be different that you would see. The charging here would be specific to the Yukon fee schedule. So you'd have your fee codes as opposed to some of these US bound charge codes that we see here. And then over here, if I can draw your attention to the insurances area, this example has Blue Cross as the insurance, which is the United States insurance provider. You, of course, would, for in territory, let's consider this example in territory, you would see insured health services for the Yukon here instead. And you'll notice self-pay. I know we're not really getting into patient billing. It's a very limited use case in the Yukon where a patient would make any payment out of pocket, but it is a secondary option which would not be billed. You would see the primary option be billed. And in your case, it would be the insured health services of the Yukon. So I just wanted to point out those few differences. But on the screen, and this would be all part of the physician workflow, again, trying to mirror what the existing workflow is, you would have up top in your charge entry block, you have this diagnoses section with the little chevron. When you expand it, you have an effective date and then the diagnoses that are fed by the physician documentation. You can either expand to this chevron and add additional codes, add, edit, or delete these codes here. You could add another effective date if you had multiple encounters with this patient for this visit or multiple visits within a short period of time. Down in the bottom in the charge block, when you expand that chevron, once again, you have some of the charges that were fed from physician documentation, and you'd have the ability down in the bottom left there, you see add transaction, and then you're brought into a window right embedded in the screen where you'd be able to add additional fee codes, or once again, edit or delete some of the fee codes that you see here. And then once the physician documentation is signed, as I mentioned on the prior screen, prior slide rather, these charges would move directly to AR, your billing would occur, and that claim would go out in the XML format to Medigent. Are there any questions about this content here? I saw the chat box pop. I'm sorry, I'll look at that after if that was directed to me. But you can feel free to ask a question verbally if you'd like. Let's give you a moment. Okay, well, don't worry, there'll be another opportunity for questions.
That's great.
Oh, good.
That's great, Matt. And I think that, so you can see here that we've got some work ahead as well. And we've been working to engage the team here in Yukon to keep going on the physician billing pieces. So if there are any questions about that, please do reach out directly to Matt. You can reach out to me and any of the members of our One Health team. And so with that, I'm going to say thank you to Matt for giving this presentation for us. And I'll turn it over to Julia, who will start her presentation around the patient chart.
All right, thank you, Jennifer.
All right, great. Thank you so much. So just give me 1 second here and I will share my screen. Okay, so can everyone see my screen okay?
Yeah.
Okay, perfect. All right, so thank you so much. My name is Julia Dugan. I'm a marketing solution specialist working with Meditech and working on the physician experience team. So today I'm going to take you through charting and documentation and how quick and easy it is through Expanse. So right now we're taking a look at the clinical home screen. On the left-hand side here is my schedule for the day with all of my patients. On the right-hand side, I have a couple boxes here that are going to help drive my workflow. So I have my recently accessed box for any patient charts that I've accessed recently, as stated there. With Meditech's integration, it's any of them I've accessed within ambulatory, acute, or ED. Tucked behind that is my workload. So here is any tasks that are assigned to me. A nice, easy way for me to be able to stay on top of my tasks throughout the day. And tucked underneath that is quick links. So it's going to be any websites I access on a daily or a frequent basis, which I am able to simply tap on the link and I will be brought already logged into that website, again, helping to save me time throughout the day. So for today's demonstration, we're going to focus on Gerard Kane coming in for a diabetic follow-up, take a look at his chart and go through documentation. But I also wanted to show what it would look like for any patients who are coming in for a virtual visit. So seeing Jenna Morrison here does have this icon for a camera letting me know that it's a virtual visit. If that was lit up blue, it would mean that my patient is in the visit waiting for me to join the visit. So going into Gerard Kane quickly, simply by tapping on his name, I'm going to be brought directly into his chart. So right away, I'm brought, a lot of information is brought directly to my eyes. Important to note too that this page is completely tailorable, depending on your specialty or your patient population to really help drive that workflow for you. So for this is tailorable through the use of blue clinical tiles or widgets. These here can be used to, again, tailor this page for you. Taking a look at the My Widget, so this is, again, for me as a provider, my patient population or specialty, any information I want to see right away. Also important to note that any of these levels here and labs are actionable, so simply by tapping on it, I have the availability to trend out this information, and as noted with Meditech's integration, it would be across the continuum. So all of these items here are actionable. My patient widget is going to be specific to Gerard. So depending on problems that he is presenting with that are listed over here in his problems list, I might want to have that information directly at my fingertips as well. So over here on the right side of my screen is my referential column that John had talked about as well, how it remains constant no matter if I'm in documentation, ordering, or chart. And there's a really nice function here, which is the search chart. So if I am going through my documentation or my ordering and I don't remember a specific lab or a certain level that I'm looking for, if I simply type it in, it's going to bring it down to that single query, where simply tapping on it, it brings it up directly for me as well. And this reference column also does have widgets and is tailorable to you to have information that you need readily available as you're going through your documentation and ordering for your patient. So we do have some tabs listed here at the top as well as we're looking at our summary page right now. Jumping into our activity page, this is going to house all the information for my patient depending on any visits that he or she has had. So right here is a really nice way for me to be able to take a look and see if they've been in the ED, if they have any inpatient visits, and by going through each individual section, opening this up, it will show me everything that happened during that visit. And these are also actionable. So if I wanted to open up this lipid panel or that A1C by simply tapping on it, it's going to bring me directly to that information as well. So again, really nice way for me to find out information of what's been going on with my patient's health since the last time I saw them. Our health management tab, this is going to be really helpful as well with helping to manage our patients with chronic conditions. Depending on problems that are listed for them underneath their problem list, it's going to create protocols. So right now we're looking at adult diabetes, and this is going to give us recommended consults, labs, immunizations to make sure we're keeping our patient's health in check. And what's really nice about this as well is that you're able to directly, simply by tapping on these, order these up and queue them to be signed off later on in ordering. So a really nice quick way for us to have that available. So once we've gone over the patient information here, I'm ready to begin my documentation with Gerard today. And right now we're taking a look at our office visit template. At the top, we have our intake where we're able to go through and complete the vital signs, complete that COVID risk screen, and any other information within intake. Important to note that that primary visit reason, which is the diabetic follow-up, is going to drive the rest of our documentation to help make it easier for us to move on through. So within Expanse, we do understand that there are familiar ways that physicians and providers are comfortable with documenting, whether it's dictation, whether it's typing, whether it's using dot phrases. You do have the option to use all of those within documenting in Expanse. And I'll go through really quickly and show that. For our patient, family, and social history, it's important to note it's going to flow. So whether it was completed in ambulatory ED or acute, that information will flow in here, and you do have the option to update it with your patient as well. So as I mentioned for Gerard, for that HPI, he's coming in for that diabetic follow-up today. HPI is going to be driven by that. So here I do have the availability to tap on any pertinent positives. Also, if I wanted to go ahead and type my HPI for my patient, I have the availability to free type as well. Or I could dictate I'm using M modal, but you are able to use dictation as well within here. Once we've gone through our HPI, going down to review of systems and exam, instead of opening up each section and documenting each pertinent positive, we do have an easier way to help drive your workflow, which is through the use of typicals, and that's this T up in the right-hand corner. Once you tap on this T, it's going to open up that list of typicals, and these are a really nice way for you to be able to document on problems that you see on a common basis. So again, depending on your population or specialty. So for me today, I do have a diabetic typical that I want to go ahead and add in here. And once I apply this, it's going to populate that review of systems and exam, really helping to save me time there. If there's anything that I needed to add, I could open up each section and simply tap any pertinent positives. The typicals are really easy to create by yourself without the need of IT through the utilization of this gear right here. You can go through, create a new typical, and depending on what you've documented up to this point, you can take pieces out if you don't want to add them in, and then simply name it, and it will add itself to your typical list for future use. For assessment and plan, same thing as I mentioned before, driven by the reason for visit. You have the availability to dictate to free text, to also go in and add dot phrases, as I mentioned, which within Meditech, we call it quick text. And then can text is going to be those dot phrases, but on an organizational level. Just some more tools to help you get through your documentation quickly and efficiently. So now that we've taken a look at our documentation, jumping on over into my orders quickly for Gerard, his current medications are going to be listed here at the top. And when I was in the chart in that health management tab, I had queued up that A1C and lipid panel, and they're waiting right here for me to sign off on. If our patient did let us know he needed a refill, you're able to simply open this and tap refill, stop, or hold on any of these medications. And once you have signed off, you are able to either print or fax these medications. So that was a quick overview here of our patient charting and documentation. So before I pass it over to Matt Keating for the rest of the demonstration, are there any questions that I can answer? All right, so Matt, I will pass it on over to you.
Great. Thanks, Julia.
Sure.
Greetings, everyone. My name is Matt Keating. I'm a marketing solutions specialist with Meditech's Patient Financials Group, and I'm going to be showing some patient portal functionality as well as some additional information to follow up on Jonathan's presentation regarding the ambulatory front office. So I'm accessing the patient and consumer health portal from my desktop. We also have an M Health app, which patients can have on their phone. They can utilize that to book appointments, they can use that to book appointments and check in when they get to the clinics, but I'm going to be showing the desktop portion here. So as you can see, we have myriad capabilities here, such as direct messaging to providers or to the clinics. I can look at information that is contained within my health record. So if there are any lab results or any scans, I can have access to that information from here. The health tracker is able to consume any information from wearable devices, and I can also input information manually. So if I'm tracking my A1C, I can input that here. We're going to book an appointment. I'm actually going to book 2 of them today so I can show you the check-in process as well. We're going to do a virtual visit and a 30-minute office visit. And then if I want to make any changes to demographics, I have the capability to update that information within the profile. And that's going to be consumed by the clinic. And once it's brought into the system and approved by a staff member, then it will update across the entire continuum of care. So let's go ahead and book those appointments. So in the appointment booking routine, we can see any existing appointments that may be coming up. I can see that Joe Krupp, our patient for today, has a CT scan that's upcoming. So this makes him aware of that. So let's go ahead and start that booking routine. So I'm presented with all of the various appointment types which are available to me as a patient based upon what the organization would like patients to have. This is tailorable to you, so if you want to limit the types of appointments that they can direct book, that is at your discretion. The first appointment we're going to book is that virtual office visit. And so when we start that routine, we're going to be presented with the earliest possible available appointment. And we do have access to viewing the entire schedule if the first available doesn't work. So we can jump from day to day for various providers to find those appointment types that do work. But in this case, I'm just going to take the next available, which is at 3:50. And this is going to ask me for some information pertaining to the reason for my visit. I'll say that I'm coming in for a cough. If the clinic needs to reach out to me, then I can include my contact information. And I can also say I have fever. So when I submit that, I'm going to get a confirmation that that appointment has been booked. And that's going to automatically fall onto the scheduling grid for interaction by the provider. I'm being pushed forth visit questionnaires pertaining to my visit. So we can quickly go through the COVID-19 screening. These are tailorable to you as well. If this is information that you would like to capture prior to appointments, then these tailorable questionnaires can be pushed out and completed on the, if they're doing the appointment from their home or via the mHealth app as well. So we'll say no, we do have fever and cough, have not traveled from a high-risk country or been in contact with high-risk persons. So we'll submit that, and that is now being sent over to the clinic. So now let's go ahead and book that additional appointment that I wanted to point out, the 30-minute office visit in our Norwood Ambulatory Clinic. And so again, I'm going to be presented with various providers and that first available appointment. And we're going to take Dr. Fanning again, and we're going to put the appointment at 4:20 this afternoon. I'm going to input that same information that we put before. And then we're going to get that confirmation that this appointment has been booked as well. We can complete those questionnaires here as well. We already did that for the virtual visit, so I'm not going to do it from here. Now, before I transition over to the ambulatory front office, does anyone have any questions? Okay. So now we're in our ambulatory front office solution. I am utilizing my Google Chrome browser. That's our preferred browser. Any device that grants you access to the internet will get you onto Expanse. And just to orient ourselves to the screen, I'm going to maximize it so we have the best possible view. And we can see that it's broken into a few distinct parts. On the left, we have the schedule for our Norwood Physician's Office. This is a resource dropdown, and I have access to all of these resources. Again, this would be based upon my role at the organization, and it's tailorable to you. So it would be a more streamlined view depending upon what the responsibilities of the user are. I can see all of the various appointments for all of our providers who are going to be coming into the clinic today. And if I needed to quickly search for a particular patient, I can input information like a date of birth, a phone number, and quickly pull those appointments up. So I can see right now the virtual visit and the additional visit, and I can see that they were booked via the portal. So it's just a quick way for me to find those appointments if the patient does call and they need to make some changes. In the middle, we have our workload, and this is representative of the tasks and messages that are flowing through to me automatically based upon my role in the organization. The to-do list is specific to me. It's personal and professional. No one else can see it, and it's just a way for me to add things on the fly that may need to be accomplished during the day. It's very easy to manipulate these and make any changes, and then when I complete them, I can check them off. If I need to add a new one, I can add one utilizing this plus button. And our quick links are going to allow me to reach out to specific websites that are going to provide me with the quick capability to conduct whatever business I need to on those websites by opening up a brand new browser window. And then when that is completed, I can close it out. It'll return me back to my session. Across the top, we have our navigation bar. The return to button is going to allow me to access any desktops that I have been utilizing during this present session. The home button is going to bring me exactly here to the home screen. The scheduling grid we're going to look at momentarily. And if I have a patient highlighted and then I launch into the patient summary or clinical chart, it will launch me directly into those elements for the patient that I have selected. The workload is indicative of the information that's contained in this middle panel. We have some statistical access from here, so we can look at appointment types if we want to see if there are specific appointments that are problematic, or we're having some cancellations and no-shows because we want to make sure that we get our patients coming in. I can track that information from here. I can schedule a meeting with members of my team or organization. I can look up their contact information as well. If I have patients who are in the clinic and they want to access the portal or they want to join the portal, I can help manage that with this manage portal routine. And then in the more dropdown, I have additional information which is going to help me to conduct my duties. But if you see that there's any information here that you'd like to have on the navigation bar, then that's tailorable to you and we can set that up. I'm able to compose via our inherent secure messaging, any messages that I want to share with members of the organization. And then utilizing the master patient index, we can pull up any patients that we want to search for that are within our continuum of care. And when we do a search, we're going to be presented with a weighted best match. So in this instance, there's only one IRO in our entire continuum of care. But if there were more than one hit for that particular search, I'm going to get a weighted best match. It's going to show me how strong that result is. And by adding in additional criteria, it's going to come up with a stronger match. So that being said, let's jump out to the scheduling grid and I will show those appointments on the grid that we just booked, and we'll go ahead and book in Joe Krupp for his in-clinic appointment. The scheduling grid is going to give me a tabular view of all of our providers and the appointments that are coming in today. Now I can change the various resources here that I'm going to be looking at the schedule for. I could quickly change the date utilizing this date changing routine. And these are all the providers within our clinical setting today. As you can see, there are many here. It's limitless to the amount that you can input into the schedule. And we can see here various appointments which are coming in. They're color coded as I indicated before. I have a legend in the top right, and this is tailorable to you, which is going to allow me to quickly identify the appointment types that are coming in. So if I scroll down on Dr. Fanica, we have Joe Krupp, who is presenting for his appointment, and the indicator dots show me those patients that have not checked in yet. So red represents that they are not here. Green represents that they have been checked in and are either in our waiting room or are with a provider. So let's go ahead and start that check-in routine for Joe Krupp. So just by tapping on the appointment, I'm brought forth with some information, including a thumbnail image for positive patient identification. If I want to do further identification, I can provide or ask about telephone numbers or some demographic information just so I do get that confirmation. So let's go ahead and start that check-in process. And we can see in the check-in process, any changes that were made. We want to make sure everything is up to date so we can consume that information from the medical record. And we're able to see any authorizations or referrals that are flowing through with this appointment if there are any associated. We'd be able to access that information from here. Any forms or labels that need to be printed out and captured, we can do so either in a paper format and scan it into the system. If you're collecting signatures or authorizations digitally, then we fully support that technology as well. Insurance information would be included here. Now we can say that he is verified, and it was verified today. And if we wanted to query out and get that insurance verification, we can do that in a number of ways. We can queue it up in a batch so it can be sent out to the payer either the day before, a week before, whatever the case may be, however you think would be the most effective workflow. But I can also query out in real time. If he was a walk-in patient and we wanted to see what type of his insurance coverages were, I can click on that green globe that I just tapped on, and then I can view the response that we get back from the payer. And that will show me the inquiry that went out, the response that we received back, and what has been inputted into our system. So now that I have all the information I need, I just want to make sure that his IDs are up to date. If his ID was expired, I would get a red indicator here in the date, which is going to prompt me as a front office staff member to collect the most up-to-date information so I can utilize the scan feature to bring it into the system. I can see the reason for his visit today, which is recorded, is for that cough. And any reason for visit diagnosis codes on the back end when we check him out They're going to flow through, as well as any provider documentation or education that he wants to share with the patient. And additionally, if the provider wants to set up a follow-up appointment, I could carry all the information from today's appointment and have it automatically applied into that booking routine. So we're able to nail down that appointment before the patient leaves. Now we have all the information we need. When we go to check him in, we're going to be prompted for a questionnaire to be completed. And our questionnaires have intelligence included within. So we're able to access it from here. These are tailorable to you as well. Now I can require that I capture the most up-to-date information every single time, if that is your discretion as an organization, but I can also bring forth past answers to further expedite this process. So we could quickly move through these questionnaires.
Hey Matt, I'm just gonna jump in. I'm not sure that this part here is relevant to our Yukon context. And so I think we'll just pause at that point there.
Okay. So I just needed to, it wouldn't let me complete the check-in because of the US-based system until I completed that.
Okay.
So now that that's been completed, we can go ahead and check him in. And when we return back to the grid, we will see that his indicator dot has been changed from red to green. So now the green indicator indicates that he is in my waiting room and he's available to be brought to the provider. And that concludes the portion that I have to show. Does anyone have any questions? Wonderful. Well, thank you very much, everyone. It was my pleasure to speak with you this afternoon.
So thanks very much to all of our presenters and our participants today. If you do have questions, please feel free to reach out to me. You can reach out through Dr. Smart through YMA if that's your preference. And we have our One Health team, of course, that you can connect with as well. We will send out some further information and provide opportunity for a forum for some further discussion. And with that, I'll just say thank you very much for your participation and wish you a great day.
Thanks, everybody.
Thanks, Jennifer. Thanks, everyone.
Have a good day.
Take
Thank you,
care.
everyone.
Happy weekend.
Have a great weekend, you guys.